Welcome to The Explainer. Today, we're going to peel back the layers on a piece of medical technology that gives surgeons a kind of superpower, the ability to see not just where a problem is, but exactly what it's doing.
All right, let's just jump right in with a question that really gets to the heart of modern surgery. So imagine you're a surgeon planning an operation. You've got a tumor to deal with. Now, of course, you need to know its precise location, but is that enough? You also need to know how aggressive it is, how metabolically active those cells are. One tells you the geography, the other tells you the threat level. For a long, long time, these were two totally separate questions, and they were answered by two totally separate technologies.
So, to solve that first part of the puzzle, the where, surgeons have relied for years on this incredibly detailed anatomical map. And the technology that creates that map is called computed tomography, or as we all know it, the CT scan.
So how does a CT scan actually work? Well, think about a standard X-ray. It's kind of like a shadow puppet show, right? It's flat and everything's kind of layered on top of each other. A CT scanner completely solves this problem. It revolves an X-ray source all the way around you, taking hundreds of little snapshots from every possible angle. Then a powerful computer takes all that information and reconstructs it into these stunningly precise cross-sectional images of your body's internal architecture. And this really gets to the core strength of CT. It is, without a doubt, the ultimate anatomical roadmap. The spatial and contrast resolution is just incredible. It can tell the difference between different soft tissues, map out every organ, and pinpoint the exact size and location of a mass. For a surgeon, this is absolutely invaluable. But it's still just a map of the terrain.
Right, so that map is fantastic, but it only tells you about structure. It doesn't tell you a thing about function. To really understand what the cells are doing, well, for that we need a completely different kind of map. We need a metabolic heat map, and that is exactly where positron emission tomography, or PET, comes into the picture.
You see, unlike CT, which shows you anatomy, PET imaging shows you physiology. It kind of reveals the secret life of your cells. By using a special radioactive tracer, PET lets us see metabolic processes happening in real time. It's less of a roadmap and way more of a live traffic report, showing you exactly where all the action is happening in the body. So how on earth does it reveal these so-called hotspots? Well, the process is pretty brilliant. The most common tracer is a radioactive version of glucose, called FDG. And you can think of it as a kind of sugar-coated spy. See, cancer cells are incredibly hungry. They're metabolic engines, and they burn through glucose much, much faster than most healthy cells. So they just gobble up this FDG tracer. Then, as the tracer decays inside these superactive cells, it sends out a signal that the PET scanner can detect, making these metabolic hotspots light up like a Christmas tree. So you see what's happening here, right? We've got two incredibly powerful tools, and each one answers one half of our original question. CT gives us the where with incredible anatomical detail, and PET gives us the what it's doing by showing us its metabolic function. But, and this is a big but, look at the trade-off. PET has really poor spatial resolution. Those hotspots it creates are kind of fuzzy and indistinct, which makes it really hard to know their precise location. So what was the solution? You've got this problem. One tool gives you a sharp map, the other gives you a fuzzy heat signal. Well, this is where engineers and physicians got really clever and found a brilliant way to combine these two separate worlds, creating a revolutionary diagnostic tool that finally gives surgeons the complete picture. And the breakthrough idea, which is summed up perfectly here, wasn't just about, doing a PET scan and then wheeling the patient down the hall for a CT scan. No. The genius was building a single machine that could perform both scans at the exact same time. The software can then perfectly register or overlay the two sets of images, fusing them into one coherent picture. And the result is, well, it's just breathtakingly clear. You get the functional data from the PET scan, that metabolic heat map, and it's layered with perfect precision right on top of the anatomical data from the CT scan, that structural roadmap. And just like that, the surgeon's original dilemma? It's solved. Now they can see exactly where the most aggressive, most active tissue is located within the body's anatomy. You really can't overstate what a game changer this was for the surgical field. It dramatically improved the accuracy of cancer staging, because now a surgeon could see if the cancer had spread to tiny little lymph nodes or distant organs, metastases, that a CT scan by itself might have totally missed. It helps them guide a biopsy to the most active part of a tumor, and it allows for much more effective planning for surgical resections, helping ensure they get all the dangerous tissue out. Okay, but, as with any massive leap in technology, it's not all perfect. There are always trade-offs. So it's really important for us to take a balanced look, and not just the incredible strengths of PET/CT, but its limitations too. So what are they? Well, on one hand, the strengths are just profound. A single scan gives you both functional and anatomical information, and it can precisely locate disease anywhere in the body. But on the other side of that coin, you've got some serious drawbacks. For one, the technology is incredibly expensive, and it's not available everywhere. And because you're getting both a nuclear tracer and a full CT scan, the patient receives a pretty high dose of radiation. These are really critical factors that doctors and patients have to weigh. So all of this leaves us with a really fascinating question to think about. We started this explainer with a surgeon's dilemma. We saw how a fused technology helped solve it by literally making the invisible visible. As our ability to see disease on a molecular and metabolic level just keeps getting better and better, how is that going to change the very definition of what it means to be a surgeon? That line between diagnosing a disease and actually treating it, well, it's getting blurrier all the time.